Welcome, everyone. It's the top of the hour, and we are going to begin our presentation for today. Hopefully when I get this right here. Welcome, everyone. The League of Women Voters of the Bay Area welcomes you to climate change and its impact on our collective health. My colleague, Raina Larry, and I, Marianne Shovelin, are really excited to present our expert speakers. We have Dr. Diz Swift, the Director of Natural Resources for the League of Women Voters of California, Callie Lee, Executive Director of the UC-CSU Environmental and Climate Change Literacy Projects, and Lisa, hopefully Dr. Lisa Patel will join us, Director of Medical Society Consortium on Climate and Health. Hello. We want to make sure we can hear everyone who is going to be speaking. So if you're not a speaker, please mute yourself.
Dr. Patel is here.
Okay, wonderful.
Moving around.
Okay.
Marianne.
Again, welcome everyone. If you're not speaking, please mute yourself. The League of Women Voters positions include promoting the health care system for the United States, and that provides access to a basic level of quality care for all residents and controls health care costs. And on climate change, it supports the climate goals and policies that are consistent with the best available climate science that will ensure a stable climate system for future generations. My colleague, Raina, has a few other comments she would like to make now.
So a very warm welcome to our panelists and our immense gratitude to you for being here today to discuss this important topic. Today, we will look at the climate crisis through the lens of health. According to the UN, climate change is the single biggest health threat facing humanity, with environmental factors taking the lives of 13 million people each year. In our discussion today, we will explore the intersection of our health and the climate crisis and discuss the crisis's devastating toll on our and our planet's health. Climate change has emerged as a public health emergency with consequences to both our physical and our mental health, with a disproportionately high impact on our most vulnerable communities, our children, the elderly people with compromised immune systems, and our less affluent populations, making it both a health and a health equity issue. We will discuss strategies needed to address the crisis as a community and as a nation. Marianne.
And now we're going to start with our speakers. Our first speaker is Dr. Diz Swift, and she has led the League of Women Voters at all levels of government in recognizing the urgency of taking action to slow and reverse climate change. She brings her scientific doctoral training and her many years of technical management experience at Chevron to educating league members and the public, and to shaping and leading league policy and action. She will briefly describe the science, touching on tipping points and the urgency of climate change, and then introduce how climate change affects health. Dr. Swift?
Thank you so much. This is an opportunity that I am very happy to have. There's never enough words out there about what climate change is and how it's affecting everyone. And it is affecting everyone. This is from the League of Women Voters US site. And as you see, we recognize that we have to protect our planet and people from the health effects of climate change, while also providing a pathway to economic prosperity. We are on track right now to get to 1.5 degrees Celsius by 2034. This is data from 1970 up to the present, ish. Actually, it's not quite to today, but it's close enough. And if we're on track with this projection, we're going to get to 1.5 by 2034, 10 years. And that's anything above that is going to everything will get continually worse. In August of last year, we were at 1.5, and we have been at 1.5 now for a couple of months this year. So we're doing well, getting there. The problem is that we're not slowing down. These are greenhouse gases of carbon dioxide and methane shown up to the present. These data from NOAA. Carbon dioxide is continuing up. Methane is continuing up, in fact, accelerating. We're right now at 412 parts per million of CO2 compared to 300, which was what we were in pre-industrial age. Methane at 1920 compared to 800, so more than double what we were in the pre-industrial age, which, as most of you probably know, methane is more potent than CO2 in causing warming. California has shown it's possible to actually reduce greenhouse gas emissions without hurting the economy. These data take up to 2020, but the trends are continuing. We've dropped greenhouse gas emissions. Population has increased. Population GHG per capita has gone down. And GHG per GDP has gone down. So we've continued to increase GDP. That little glitch there is simply a glitch. GDP is going up. GHG is going down. Can be done. But as we saw on the previous slide, emissions are not slowing. And that's not because of California. It's because primarily of China and India are really increasing the greenhouse gas emissions. Europe and the US are relatively flat now. We're not continuing up. China is a major contributor. They're 35% of emissions, but they may reach peak by 2030 and neutral thereafter. They are very aggressive in working on reducing greenhouse gases, have a huge population, and so that makes it very difficult. This is a picture of a solar array in Shaanxi province. In 2023, they put in more than 216 gigawatts of power, which is enough, almost enough to power the entire state of California for a year. That's a huge amount. So they're moving forward, but a long way to go. So let's talk about where we are right now in terms of the effects of climate change. Oceans are super important. and we'll talk about oceans a little bit here. They are the largest carbon sink. They have absorbed a significant amount of the heat and CO2. And without the oceans, we would be in such a much worse position. So we really need to understand what's going on in the oceans. And oceans affect everyone, no matter where you live. Even if you're not on the ocean, they affect climate. Melting of polar ice is continuing and accelerating primarily in Greenland. It's because of the heat in the atmosphere, but also the heat in the oceans. You can see Greenland is actually melting a little faster than Antarctica. But this area of Antarctica, the Amundsen Sea, is super important. It has a couple of glaciers there that are melting. They've come unstuck from the seafloor and they're all uphill. So they just flow into the sea. And because they're unstuck, they're unstoppable. So they are causing significant sea level rise. It will happen a little bit faster when those start to really melt. They're already on track. Why is melting of ice important? It affects this huge thermohaline circulation pattern, which it extends throughout the globe. Thermo means heat, haline means salinity. This thermohaline circulation brings warm water from the southern hemisphere to the northern hemisphere in our western hemisphere. Well, it gives nice warming over here to Europe that won't happen if it changes. And in fact, this thermohaline circulation is shown to be slowing down significantly. That's going to lead to a cold patch off Greenland right here, as well as many other changes. And this is arguably the strongest control on climate effects. So it's a tipping point. Once this starts to change, you're not going to go back. The other tipping point that's very worrisome is related to the Arctic. These are data shown from NASA from 1884 to 2012, showing the increase in warming color shows the increase in temperature. 1884, Currier and Ives, people ice, very nice, but it's been warming primarily in the Arctic. This trend has continued, even though this is just showing to 2012. This area is about 4 to 7 degrees Celsius warmer than it was in the Arctic. Again, repeat, it's warming faster in the Arctic. Why is that important? Permafrost. This is a picture or a map looking straight down on the North Pole, showing Siberia here on the right and North America here on the left. The purple areas are permafrost. Permafrost is melting, and once it starts to melt, it just continues to melt. It releases CO2 and methane. So increasing CO2 and methane in the atmosphere is caused by melting permafrost. Increasing CO2 and methane then cause heat, which causes more melting, and so on. It's a cycle. We could release a huge amount of CO2 and methane, and they alone could account for an additional 3 degrees Celsius increase above what we're projecting right now. This estimate is conservative, and the change is irreversible at a human scale. This is, for me, the most concerning tipping point. Although the thermohaline circulation, arguably, I just don't understand that well enough, because that's also a very serious concern. So what are the results that we're seeing? Heat waves, drought, heavier precipitation events, either too much rain or too little, agricultural disruption, loss of crops, stronger cyclones like Milton, or rather, yeah, rising sea levels, thawing permafrost we just talked about, and all of this leads to climate migration, which is rising. And we have seen an increase in autocratic governments, which are opposed to seeing changes in demography. So immigrants, migrants typically are not looked on favorably. And we see resulting that political unrest. It is a threat to democracy. Those changes in demographics are causing political and social upheaval. Folks want answers and they want them now. Democracy is slow. It's kind of messy, but it is democratic. So you can't just force things to happen. Also, as Raina, mentioned, it's not equal opportunity. The vulnerable suffer the most. They're the ones without air conditioning. They're the ones that are more on the edge if there's crop failures and so forth. Water, the stuff of life is water, and most of the climate change impacts will be related to water. Climate alone disrupts the entire precipitation patterns, the entire water cycle. We'll see and are beginning to see water scarcity, water-related hazards. And although we rely on it, that we will always have safe drinking water, that's not necessarily a given. So climate and health, extreme heat, extreme weather, flooding, and sea level rise and drought all cause significant health effects, especially heat and longer heat. So the body's exposed to high heat for a long time become, it can lead to death, of course, but it also is just very stressful on the body. And especially for those who are disadvantaged that don't have air conditioning. We see increased crime, the link to mental health, and we'll talk more about that. Extreme weather, displacing populations, losing your home, losing your security, losing your fresh water. Mental health, again. Flooding, saltwater invasion, we lose fresh well water. That's happening in San Jose right now. Water contamination, our sewage treatment plants in the Bay Area are right at Bay level. Algal blooms, insect-borne diseases, drought, dust storms, crop failures. So there's economic and actual increase in food cost or not having food available. And a big kahuna here in California, wildfires. So we are in a health emergency caused by climate, and I'll turn it over now to hear more about climate and education.
Thank you, Diz, for your excellent presentation and your work with the League on this topic. I would like to invite Dr. Kelly Lee to share her thoughts next. She has been in the educational field for over 15 years as a high school science educator, instructional coach, and education leader. Dr. Lee will discuss her extensive work to advance climate and environmental literacy in PK through 12 instruction. She will share her perspectives and opportunities with PK through 12 and higher education partners to highlight the intersection between the climate crisis and the student physical and mental health crisis, as well as actions and solutions to best address the growing crisis. Dr. Lee, we are excited to hear your presentation.
Thank you. And thank you so much, Dr. Swift, for giving such a great overview to, I feel like, such a pressing and urgent issue. My focus here today is thinking about the role of climate and environmental literacy and how we can spotlight education as the catalyzing force to support people in thinking about climate action in meaningful ways for their communities. So I'm the executive director of this wonderful initiative that leverages all 10 universities of California and all 23 California state universities, along with a vast network of community-based partners to support PK-12 school districts in thinking about how to revamp education for climate literacy purposes. Our goal is to graduate every high school senior as climate literate in ways that allow for them to make informed decisions. And so it's a big undertaking, but we know many hands make light work. So we are definitely not alone. And we're so grateful to be able to shine a light again on education and what a powerful force it can be in communicating about these issues. So I wanted to just start off by giving an overview of the state of communication and education through some of our partnering efforts at the Yale Program on Climate Change Communication. And these are just some maps of their most recent data collection to show that overall in the United States, about 72% of individuals, and it's also broken down by states as well, feel that global warming, and they haven't updated the language yet to climate change because most people are still not associating global warming with climate change. So as they continue these surveys, they have to continue with the more traditional language that they've used in the past, even though we know that the effects are more than just warming. So just a side note there. But it says 72% of adults think that it's happening. More interestingly, those same individuals do not feel that it will really personally harm them. So that percentage drops dramatically. But interestingly, on the other end, these same individuals feel that it will harm future generations. So they know it's happening. They don't feel it's happening now, but they feel that it will happen for future generations. And I also wanted to share that startling, about 32% of these individuals hear about climate change or global warming about once a week. And the numbers are pretty striking for seeing how many individuals come across any type of climate change or global warming information more than one time a month. And we're having these conversations here, but I realize that in the circles that we occupy, sometimes we're in an echo chamber. And we feel that these conversations are plentiful, but in reality, they're just not happening on a wider scale. And there could be all sorts of reasons for that, we know, but in education specifically, we know that the majority of our educators and students alike get their information from social media and the news, which is filled with disinformation and misinformation. And so they are highly susceptible to thinking about climate change in ways that are more politicized than they are scientific. And so our job is to provide them with the most accurate information to then be able to teach scientific data and facts to students in schools. Luckily, here in California, the frameworks that teachers are required to teach specifically in science require that they teach about climate change. However, as you will also note that through the information I'll share, it's also not happening. And so one more thing I'll leave off that most educators are surprised to learn about is the overwhelming number of individuals that actually support educators in taking on this information to teaching students about. Because if educators, just like the general public, get their information typically from social media or mass media in general, and it's filled with misinformation or disinformation, you can imagine that they are thinking that this topic is heavily politicized, that there is no scientific consensus on climate change because that's what the news always puts out there. However, that is definitely not the case, but it's our job to give them, again, that information so that they can teach the science of climate change. So what is the expectation and what is the reality? So the expectation is overwhelming majority of Americans feel that it's the teacher's job to teach about the causes, consequences, and solutions to this. However, the reality is we know that it's happening in pockets of schools. We know that it's happening in different states in different ways. We also know that the information that teachers get mainly relies on whatever is available on Google and whatever information they can find themselves. This is outside of already such a demanding job where you're not only thinking about lesson planning, you're also testing, you're going through various meetings with parents, students, administrators. You're also volunteering for all sorts of things. You're thinking about mental health and well-being. School counselors on average support between 500 to 700 students each a year and are responsible for well-being and psychological care for students. The system itself has lots of opportunities for growth for sure, but in thinking about the reality of what's happening, we know that the the undertaking is disproportionate. And we also know that if we asked any two teachers, even in the same school, that say they teach climate change, how they teach it and what they teach is completely different, and how they approach it is different as well. So with Eclipse, our job is to be the agent that allows for more cohesiveness and coherence across our state. If our goal is to graduate every high school senior as climate environmentally literate in ways that allow for them to make informed decisions, then we need some baseline of what that type of education should entail. We know that it should be more than just a science education. As you all have mentioned earlier, when you're thinking about health, when you're thinking about mental well-being, when you're thinking about race, class, gender, all sorts of intersectional issues here, there are so many opportunities for teachers across the subject areas, even in physical education, even in the arts, even when they talk about gender studies or finances or the economy or whatever else they're taking on. We know that future jobs are going to be climate jobs. So there are many opportunities to lean in, but how does a teacher get that information in credible ways, and how do they get that training? Remember, their days are already so full, and they're given typically, I mean, it's not much, but it's 1 hour of planning, grading, meetings, 1 hour a day, maybe, and teaching full loads of 180 plus students. So you can imagine that there needs to be systemic changes that have to occur for this to be a reality that is realized. So I just wanted to share some other issues here that a lot of teachers rely on textbooks for information, but we know that textbook publishers are also salesmen and saleswomen or salespeople. And when you have a major publisher that is a universal source for information, when that same publisher has to sell to California and Florida and other states at the same time, that information is going to change essentially to meet the needs of that school district in a wide variety of ways. But what we're finding is in multiple studies, even in recent studies now of major textbook publishers, many of them are simply not publishing scientific consensus and scientific fact. Actually, we have found that researchers looking through and combing through these textbooks are finding that they're portraying climate change as a positive. They're portraying climate change as not anthropogenic, so it's not caused by human activities. It's a natural cycle. It's a positive thing. We should welcome it. There's nothing that we can do, essentially. And so when teachers don't have information that is readily available to them, that is credible, sourced, vetted, and at their fingertips to be able to teach in ways that they don't have to keep adapting lesson plans to, then they refer to textbooks that may be actually teaching them misinformation, again, for the purposes of being able to sell a textbook. And so this is something I wanted to point out as hugely problematic for teachers, and something that, again, needs to be spotlighted. And I also wanted to share here that when I said earlier that it's just not happening, what I mean by that is we know it's happening in pockets, but even in those pockets, it's completely disproportionate. Teachers, on average, across America spend between 1 to 2 hours per year on climate change. And just think about what that value statement is to students. When you completely omit climate change from your curriculum, you are sharing what your values are essentially on this topic by not talking about it at all. You're saying it's not worthy of our time. People are saying it's urgent, it's pressing, we need to do something now. But in your own class, you don't get opportunities to learn or even ask questions in a safe space. And for those who do teach it, typically they are spending 1 to 2 hours. By the way, as a former high school and earth science and nanoscience teacher myself for almost a decade in Los Angeles and Orange County, 1 to 2 hours breaks down to 1 or 2 classes in total. So how do you say to a student all the things that Dr. Swift has just said, and then say, okay, next we're going to learn about the atom and parts of the atom? It's confusing to students when all they have is social media that is bombarding them with information. They have questions, they don't know who to turn to necessarily. And they go to class, They get one lesson on this, and we say, oh my goodness, this is what's happening. These are the trends. You know, this is what's happening with the thermohaline circulation and the potential stagnation of the entire ocean, which, by the way, we count on for almost 50% of our own breathing oxygen. If we continue in this way, XYZ, and we express this to students, and then we say, okay, now we're going to move on and talk about XYZ. It's confusing to students. So you can imagine that teachers need a great deal of support, but it's also not only on teachers to take this on. We can't expect teachers to continue to use their time outside of school hours to attend trainings in which they have to pay for or are receiving confusing messages even in their own school districts that have deemed these topics potentially as controversial, which means that they need to go through board approval to even talk about climate change. There are so many issues that teachers have unveiled for us that, yes, get us closer to finding the solution, to supporting them and thinking about ways um, to think about how we can make that systemic change, whether that be teacher preparation programs, right? We said we leveraged all 33 campuses in California to be able to support PK-12 students. But one thing that we are thinking through is what's within our control and what isn't. We know that we can support the revamping of teacher preparation programs so that all future teachers get trained before they go into the field. That is something that is within our reach with a lot of partnership and collaboration. What about the teachers currently in the field that's facing this wrath, essentially? We're also thinking through leveraging partners across the state to provide the type of support that's needed. Now, our job is to provide that coherence. And I wanted to point out an incredible resource by Project Drawdown, who does great work in thinking through how every job is a climate job and how the solutions that we're looking for are already here if we just have the political will to enact them. And I wanted to point out that in number 3, right, they know that the top solutions for climate change include thinking about education and health as a way to mobilize people to act on climate change. So just wanted to share and again, reiterate what our mission is here, but some examples of how we support teachers that we would love to receive support on is thinking through if we are providing coherence for the state and supporting future teachers and current teachers to teach about this in ways that are culturally relevant and meaningful to them, what does that type of education entail? So for Eclipse, we leverage about 120 leaders across our state and nation to build that coherence so that teachers aren't confused whether they're in one region or a different state. They know that there are shared commonalities that we should all cover together. So I just wanted to share that we've uncovered in the past year 6 key paradigm shifts, key ways of thinking that need to change for teachers in order to do this in ways that are meaningful and activate that student agency that we already know students have. So those key shifts, and I'll share that link soon on our website here, is that we know that this type of education requires that we move beyond the science. Students are tired of hearing about the disaster and the end of the world on a daily basis, so much so that they become completely numb to it. Every day is a new disaster. Every day is a new way for the world to end. So they keep doom scrolling, right? They're just like, okay, this, what's new about this? And a lot of adults are like that too. So what we're saying is the education that we need to provide has to center on things and solutions that they can take right now, whether it be personal or systemic or community oriented, right? And so it has to activate that agency that's already within. We know it needs to be interdisciplinary. It's not a science issue. It is one that touches upon every subject area in different ways. And there's opportunities, right? Rather than thinking that this is a dreadful act, this should be seen as an opportunity for them to engage in new and novel ways, thinking about how AI can make things better. There's just so many different applications. We know it needs to be transdisciplinary. What that means is moving beyond just the school site. We should be focusing on healthcare systems, community-based partners, higher education. It needs to, again, expand beyond the school. It needs to be intersectional because, again, we have to think about the different inequities and issues of justice that touch on climate. And then also centering on equity and justice in different ways. So what does it mean to have an equitable solution? And does that mean that the solution that a teacher teaches in Bakersfield will look different than a teacher that's teaching students in Riverside in the Inland Empire? Some of those solutions may be similar when dealing with air pollution, but some will be vastly different depending on the needs of that community. It has to honor historic community and indigenous knowledge. There's different ways of traditional ecological knowledge that we should be able to lean into in respectful manners. And we also together noted that it needs to cultivate 21st century skills to prepare them for that green and blue workforce into the future. So I'll wrap here, and I just wanted to share some examples of how this type of education is changing from what it was into phenomena-based instruction. So here, starting off with students' own communities and allowing for them to ponder questions that they have about why things are different or similar and why that's important is essential. So these are just some example slides of lessons that have been developed through the network, but even simple questions like looking at these two pictures, what are some things you notice and what are some things you wonder? Thinking about integrating AI and different tech tools for teachers and students to understand their own community. For instance, with the City's Park Score app and also tool, students are able to see the areas in purple, by the way, are planned areas of where parks, they have plans to build parks in those areas. But without students understanding where those parks are going, they can't really advocate for better or ask informed questions like, well, that community already has 50% parks versus my community that, doesn't have one within a 30-minute walking distance. They need to be able to have the tools within reach to then advocate for their own health and well-being. Being able to use this type of information to understand different phenomena and health information that's happening within their own families and communities are also essential. So we look at historical data. This is not even a science lesson. This is a history, social science lesson where they talk about redlining, but they also link it to excess ER visits for asthma attacks. So how do the two relate to each other, and why are hospitals where they are? Why are they within or not within reach for specific communities? So on and so forth. But this is our way of driving questions with students based on real community issues that they notice. Same, we can talk about very lightly with elementary school students, benefits of trees and how to advocate for green spaces around them and why that's essential to be able to talk about. There are different ways that we've brought in race, class, social inequities in, again, through an opportunity where students can drive the question that they're most curious about. So as a school teacher in Los Angeles, I grew up in inner city. I'm a first generation scholar myself. And I noticed that in my community, asthma was incredibly prevalent. And I didn't understand at the time, but it was likely because I lived 3 houses down from the 110 freeway wall. I didn't even understand what light pollution was, what air pollution was. I just knew we were always sick. And I never understood why when we drove to places like San Diego, why the air smelled so good. It was confusing to me, and it was a statement where when I made it, I didn't quite understand what was happening, but I knew in my body something was different, but I didn't have the words to explain it. But as I got older and I started to learn more about my community and my environment, being able to have that language, being able to ask those questions in a safe manner, to explore with teachers who may not have the answers as well, but shows what lifelong learning looks like, is an opportunity and a gift for our students as well. So I just wanted to share that education is slowly but surely changing in how we help students to understand these issues. Now the question is, how do we get that across the state, and how much support can we get as we do that? So I just wanted to thank you all for your time and for allowing for me to spotlight education and the important role of communicating, with our students, but helping our students to also have those informed conversations with their families. I get the question all the time from students like, who's going to be the one to make these changes and to have these conversations? And I always tell them, it's not going to be me, because your parents and your auntie and your uncle and your brother and your sister, they don't know me. They don't care about me, but they do know and love and care about you. So if you can have these conversations in your own circle of impact, it will mean more because you're trusted, you're part of that community. And if I can give you the skills and the knowledge to be able to have that informed conversation, and we each do it, then we have a rippling effect. So again, thank you all so much for your time today. And I'm going to pass it on to the next speaker as well. But again, thank you.
I do want to thank you very much for your work with our students and our educators, and for your very informative presentation. We definitely need to hold our electeds accountable for effective climate policy, for change to actually happen. So I just want to talk about our next speaker, Dr. Lisa Patel. Apart from her work to advance the health outcomes of our children and our planet, she's also a member of the executive committee for the American Academy of Pediatrics Council on Environmental Health and Climate Change. She will share her work on the impact of climate change on our and our children's health outcomes. She uses her extensive experience working for government, community organizations, and nonprofits to advocate for children's health priorities in the US and to help build a climate health and equity movement with a focus on strategies and actions. Dr. Patel, we look forward to hearing your perspective. Thank you.
I'm just going to share screen. I do have a few slides. Oops, no, not that one. Not that button. Done. There we go. Y'all can see the slide. Great. So thank you so much for the invitation to be here, and I really appreciated the prior presentations that really set me up nicely to bring home some of these messages. I'm actually a practicing pediatrician. I work at a hospital, so a lot of the health impacts, I really want to talk about what that looks like as a practicing provider and what it looks like in terms of our patients and our communities. I've been studying climate change for over a quarter of a century, and 25 years ago, it was presented to me as a distant problem in a distant place for a distant species. And so much of the work that I do, both as a pediatrician and in my role as an executive director for the Medical Society Consortium on Climate and Health, is to make climate change an issue of here, now, and us. And I specifically want to talk about the us piece because, yes, this is absolutely a problem for the polar bears, but it is also profoundly an issue of our health. And so I really like the statement from the Lancet Countdown: every child born today, I would say not even will be affected, is being affected by climate change. And how we respond will determine the world we live in tomorrow and will shape the health of children across the globe at every stage of their lives. And so the question is, do we create a world where children can thrive, or are we heading towards a world where they can merely survive? There is consensus, not only in the scientific community, but in the medical community as well, that climate change is the greatest threat to public health in the 21st century. In 2022, 200 major medical journals, including the most prestigious ones like the New England Journal of Medicine, published the same editorial on the same day, making this declaration and asking our leaders to take bolder action to keep us to 1.5 degrees of warming. If folks caught, there was an editorial by the IPCC chief scientist who said that we're definitely blowing past 1.5. 2 degrees is maybe not even within reality. We're more like on a 3 to 4 degree trajectory from where we're heading right now. And 1.5 was a politically determined target, really, of what we thought we could achieve, and it's what we think we can adapt to. Past 2 degrees, we think that it would be almost impossible for us to adapt, and past 3, we're fairly certain that the type of civilization that we know and have come to enjoy is not what the world could carry on living. I want to reference another public opinion slide, and sorry that this is so grainy. And this is to get to the point of the prior speaker on how many of us are concerned versus our perception that others are concerned, to say that there are a good number of folks in this country that are either very or somewhat concerned. But then when we look at our perception of other folks as concerned, you can see that we don't think other people are thinking about it. And if I had to put my guess on that, again, as a doctor, there are folks that come in where they knew that there was something wrong for a long while, but they didn't want to face what it was. And it ends up being something like a cancer diagnosis, for example. And I think that's what this is. I think it just feels like a big, overwhelming problem that at times we feel a lot of discomfort talking about. IPCC working group called it a code red for humanity because of what the implications will be both for our health and for human civilization. And this builds off some of the conversation that we were having earlier that Dr. Swift had mentioned, that although the United States has significantly decreased its emissions, if we look at our emissions as a bucket, we've contributed about a quarter of it to date. And so we are still responsible, even though our emissions are going down, we are still deeply responsible for what damage we have caused in terms of our atmosphere and the leadership we need to show others who are trying, countries like India and China, that didn't get to benefit from that cheap energy, for example. It is our duty, it is our moral obligation to lead the way and show how that is done. And so folks probably know the Inflation Reduction Act was passed 2 years ago, and it helps us get closer to field goal distance in terms of our emissions reductions, but there's still a lot more that we need to do to actually meet our commitments. I feel concerned, as likely many of you do, because there is some talk, depending on what happens in 2025, that the Inflation Reduction Act could be repealed. Certainly, there's the possibility that we won't see any more significant federal climate legislation in 2025 and beyond. And so it makes what we can accomplish with the Inflation Reduction Act now very important. I think Dr. Lee might have put up this graphic on climate change and health, and I don't have a full hour, or actually I need a few days to go through each of these boxes. But this is to say that climate change will leave no organ system untouched, no life phase unaffected. And as we're seeing right now, for anyone who has loved ones or is in Florida, my heart goes out to the community that is suffering this 1-2 punch. And that gets to these boxes about environmental degradation, severe weather, degraded living conditions as well, right? The places will encounter one natural disaster, barely have time to recover, and then the next one comes barreling through. We're seeing changes in vector ecology as well, severe water quality impacts and water and food supply impacts for folks that are in Asheville, for example, going to have to drink bottled water for a long time because even a boil notice isn't going to keep them safe, because when these kinds of floodwaters come through, there's also things like pesticides and gasoline in the water that makes it unsafe for them to be able to drink. And I'm going to talk a little more deeply about air pollution and extreme heat because I want to talk a little bit about what this actually looks like for those of us that are experiencing it. The last 2 summers, Southwest Arizona is expected to exceed what we call the survivability threshold, probably sometime during the century. It is already starting to experience these extreme temperatures, so 100, 110 degrees, multiple days. And this is certainly an area that is no stranger to days of extreme heat, but it's the severity and the duration that have become really dangerous for a number of residents there. This is a picture of a man who last summer stepped outside of his home on a 100+ day of temperature, got dizzy, fell down, and that pavement was holding on to so much heat. He ended up suffering a 3rd-degree burn just from falling on that pavement. This graphic here on the bottom, as I mentioned, I'm a pediatric hospitalist, so I work 24-hour shifts. On a holiday weekend, I get to work 2 24-hour shifts to be able to cover so that other folks get vacation time off. So I was there that full weekend on September 6, 2022, which was Labor Day weekend for us. And I work in Livermore where our temperatures topped 116 degrees. And those 2 shifts rivaled many of the shifts that I worked during the pandemic in terms of the volume of patients that were coming in with things like dehydration. Extreme heat is also a risk factor for adverse birth outcomes as well. So I was going to delivery after delivery where there was a concern that the baby could be in trouble at birth. This is what it's like on the ground when you're treating patients during a period of extreme heat. This is from the heat dome in Oregon and Washington. Physicians raced to provide fluids to patients who arrived breathless, dizzy, and drenched in sweat. Others were brought in on stretchers. Their body temperature so high, their central nervous systems had shut down. Those who could still speak spoke of stifling apartments and sun that made their skin sizzle. Some had tried to walk to county cooling shelters only to collapse in the blistering heat. I mentioned the survivability threshold. So our physiologic studies show that the human body can generally handle up to 115 degrees, minimal humidity, drinking water continuously, no other medical conditions at rest. And it is blowing through those temperatures all over the world. And so that's what I talk about the survivability threshold. There are places in Southwest United States, South Asia, Middle East that will be exceeding those temperatures. And we can put air conditioning everywhere, but do we really want to live the rest of our lives indoors? But also back to the point that not everybody can afford it, which is the next slide. So those that are the most vulnerable during periods of extreme heat tend to be those that cannot afford it. In addition, because of historic redlining, as Dr. Lee had mentioned, some areas and cities are measurably hotter. And just so that we have some time for questions, I'm going to move us forward to thinking about who those vulnerable communities are, which are individuals that, for example, are experiencing housing insecurity, which is a big problem here in the Bay Area. So not only do we have an issue with people that may not have safe shelter during periods of extreme heat, some places are just poorly adapted for periods of extreme heat. I live in San Francisco, where very few households actually have air conditioning because we've never traditionally needed it. The households that might have air conditioning may not be able to afford to pay for those energy bills. Just another sort of reporting of what it looked like for communities that were unhoused in Phoenix. This was reporting that came out of Politico: summer burns in Phoenix, scorching pavement, blisters, uncovered skin, pus oozes from burned feet, and bacteria teeming wounds fester under sweat-soaked bandages for people living on the street, and they might be the lucky ones. And this is the mortality from heat-related deaths in places like Phoenix. How much time? Should I leave about 5 minutes for time, Raina? So I'm just going to move ahead just for the interest of time.
Well, this is an interesting presentation, so please take your time.
Okay.
I think if you have the time. Yeah.
Yeah. So this study came out a few years ago, and it looks like at the intersection of air pollution from the burning of fossil fuels in addition to heat. What it shows is that there is good evidence across the studies that air pollution and heat are drivers for poor birth outcomes like premature birth or low birth weight infants. Now, this matters in terms of the lifetime of a child's health, because children that are either born low birth weight or premature are at higher risk for a variety of chronic medical conditions down the line. There were marked racial disparities in outcome, particularly for Black and Hispanic women, with there being multiple factors associated with that, likely due to air pollution from redlining, poor access to prenatal care, and the toxic effects of racism on a mother's health. As we think about other populations that are vulnerable, in addition to pregnant individuals, infants are particularly vulnerable during the first week of life. I've treated a number of infants now who came in during heat waves, again, because the Bay Area is poorly adapted for extreme heat. I cared for it was a teenage couple that had a brand new baby in an unair-conditioned apartment in Oakland, had really hung on the words of every provider because they didn't feel confident as new parents, and had been told by the nurse to put a hat and a blanket and a onesie on their baby in an unair-conditioned apartment. And their baby came in severely dehydrated, and they were just so distraught because they thought it was all their fault. And so that kind of counseling, understanding how these environmental threats are playing out is so deeply important. And then outdoor workers, it is tragedy after tragedy that we are seeing of outdoor workers who are not being protected during periods of extreme heat and are working in deeply unsafe conditions. In places like Texas and Florida, we have seen them actually pass state laws that preempt local ordinances to protect outdoor workers. Fortunately, there is actually OSHA has introduced federal regulation to mandate protection for both outdoor and indoor workers, and that's winding its way through the public comment process right now, because outdoor workers are highly vulnerable during periods of extreme heat, and especially we look at certain industries like farming in particular have additional vulnerabilities that might make it hard for them to advocate for their own health or their own rights. I'll talk very briefly about wildfire smoke, especially for those of us that live in California. We understand that it's become a more or less a yearly threat to us and our health. There was one year in 2020 when the wildfire, those plumes of smoke were so overwhelming. I walked into the hospital and you could smell the smoke inside the NICU because there was so much overwhelming smoke outside. And the reason why this should concern us is because the fossil fuel pollution that we are always breathing because we burn fossil fuels, produces these tiny little particles that we inhale, enters our lungs and vasculature. And if you see this graphic here on the bottom, you can see all of those outcomes in red we have very good evidence for. Fossil fuel pollution drives 1 in 5 premature deaths per year. Fossil fuel pollution is a top three cause of dementia. There's a new study out that shows the markers of Alzheimer's in the brains of children that lived in polluted cities of Mexico. What is concerning to us is that wildfire smoke, we think, is 10 times worse than that. And this was based on a study where you took the fossil fuel pollution that we are always breathing, and you took an AQI of 50, and you took a similar AQI of 50, and it was wildfire smoke. 10 times as many children showed up with respiratory complaints in an emergency room. What we see during periods of wildfire, so we see more episodes of asthma, pneumonia, bronchitis in children, and wildfire smoke is linked to additionally to poor birth outcomes like prematurity, low birth weight, and emerging evidence for stillbirth as well. This is not accidental. Our sites of fossil fuel extraction, combustion, and refinement tend to happen in sites that are communities of color and communities experiencing poverty. And that is why we see these health disparities, that a Black person, for example, is 4 times as likely to die of fossil fuel exposure compared to a white person, and 75% more likely to live in a community that borders a plant or a factory. As we think about, I just want to skip ahead to this because I think it is deeply important to this narrative and a lot of the work that we are doing. I work as a pediatrician, and we keep talking about how, well, we should just build children's resilience. We should build the resilience of our healthcare systems and the resilience of our schools. And in my view, we shouldn't be asking children to be more resilient. We should be removing the social license of the fossil fuel industry to pollute and pay for the consequences of what they have done. It would be one thing if they have had the opportunity to be honest brokers and really come to the table and be a part of the clean energy transition. But their actions including up till now show that they are not authentically in this to solve it. They will squeeze this planet for every drop of profit they can get, not just on the backs of our health, but particularly on the health of communities of color and communities living in poverty. We are doing a lot of work on how to message specifically around fossil fuels. The more I do in this work in the space, I don't think that climate change is the words we should be using. I think it is fossil fuels, because climate change does not point us to the true upstream problem and where the power really lies. And so we think it's really important to raise public awareness and consciousness about fossil fuels as the cause and fossil fuel CEOs as the reason why we are in this crisis. I'd welcome you to join our listserv and learn more about some of the communications resources and the advocacy we're doing to hold those companies to account.
Thank you so much, Dr. Patel. This was really valuable. I think Dr. Lee had to leave, but would our other panelists, would you have time for a few more questions? Okay.
I have 1 more minute.
Oh, yeah, 1 more minute.
Sorry.
So I'm really interested in this. Can you address the environmental impact of war? As a British study framed it, the military blueprint of war and the relationship to climate change in our health in populations not even directly impacted by combat, including long after the wars are over. Is that something to speak to?
Is that for me? Or is that for?
Oh, anybody who can do that. Dr. Patel, please go ahead.
And sorry, the question was like thinking about the impacts of climate change in places that have experienced war, or how it
Yes, exactly. There was recently, I read a study about the blueprint of war, because they're saying that when you drop bombs, the impact just lasts for the longest time.
Actually, I'm trying to remember her name. She actually came up with the term climate threat multiplier for climate change. She's a security expert that consulted for the military. And so she was talking about how they framed these threats and climate change. They used to think that climate change threats would go up like this. And now she's like, climate change is more like a series of bombs going off in different places, and you never know how big that bomb is going to be. So I think that is a better descriptor as we think about what climate disruption looks like. And I deeply apologize. I have to go to my next meeting, but thank you so much for the invitation.
Thank you so much.
And thank you. Oh, and we really appreciate all of our speakers. And we are going to invite them back next year for another session. Because from what we have all experienced during this presentation, there is a lot more to learn and a lot more questions that we have that we would like to have. We as a community, as a civilization, would like to have answers to. And I'm sure our speakers, in fact, we tested them beforehand, and they would be coming back to share their knowledge with us again. Again, thank you so much to our speakers and to our participants for hanging in there with us and experiencing this series of fire hoses of knowledge from our speakers. We will be making both the chat, which has a fantastic array of resource links in it, as well as the link to the presentation available on the League of Women Voters Bay Area website in a couple of days. And again, thank you so much to you all for your presence, your knowledge, and sharing your experience.
Thank you so much.